Afternoon to ladies and gentlemen. Yeah, today is our Facebook Live again. All right. So very thank you and very welcome to all of you who join our Facebook Live. Yeah, let's spend 1 hour today here to talk about slimming. Today's our topic is talking about weight reduction, made easy. Yeah. So any one of you who are struggling in the mind, okay, about slimming, meaning to say probably you are facing through some problems of slimming. Yeah, you are unable to slim down easily, or you may try to slim down but it was not successful, or if you have tried some slimming but it does not achieve, the weight that you are aiming for, or you keep on gaining weight easily, okay, regardless how suffering you did to reduce your body weight. Yeah, you probably managed to reduce certain body weight, but then it rebounds back again. Struggling in the mind, okay, about slimming, okay, so you should watch till the end of this today's live topic if you are having these problems, struggling in your mind about slimming, okay, which probably will help you, for the best future. Okay, just spend a little bit of time to get the idea and understanding right, then it probably will change your whole life. Okay, so today's topic is talking about weight reduction. And why I'm talking about this topic is because Malaysia here, we do have high rate of obesity. Yeah, and this obesity create a lot of diseases risk. For example, diabetes, hypercholesterolemia, hypertension, stroke, cancers, and a lot of poor in health quality, which causing a poor quality in lifestyle. So this is a major issue in our health issue, and also beside health issue, it also affects uh, individual perception, the individual image. When you are obese, so you probably have a less confidence level, more introvert, not so confidence, okay, and this impact on self-esteem is actually significantly affecting a person's lifestyle and also the prospect of life. So if you are always low confidence, low self-esteem, probably you probably have very low confidence, to deal with your friends, to talk about relationships, probably affect your relationships, your career, your performance. So these are the things obesity brings to a human. So today's topic is talking about weight reduction, and weight reduction has been never stopped. Sort of like being mentioned, talking. But the thing is, why there are so many people still obesity in our surrounding? Is that something not right or something not fully understood? Okay, so today's topic is to let more people understand about the proper knowledge or proper understanding. How do we understand our body so that we can do something to reduce our weight, or if you are not overweight, how to prevent or sustain, your current body weight in the optimum mode. And for those who are already obese, how can we do, or what should we do, okay, by proper understanding our body, and then go along to the body's characters and metabolism, how or what you can do to slim down in a more successful way. Okay, so today's topic is very simple. We try to make it simple, easy to understand, and make it easy. So that's why we call it weight reduction made easy. How? Okay, it's a Q&A sessions, question and answering from me, Dr. Jeff. I'm from Revival Clinic. Nice to see every one of you. And I welcome every one of you to join our Facebook Live to get more information, more knowledge for your benefits. Okay, so let us begin. So I have compiled several questions from my patients throughout almost 15 years of experience, seeing patients with facing obesity problems. So I try to sort it out in more on lifestyle problems, and also more on the treatment base, and what is the misunderstandings that people gone through when they are going through their slimming, because there are many slimming centers that trying to promote something, some treatments for you that probably that is not successful. I'm hearing a lot of stories, people saying that they spend a huge amount of money in certain centers for slimming, but at the end of the day, they didn't succeed to achieve what they want. So is that something wrong? In between this, is it that patient do not spend enough money, or patient do not the problem is on the patients, or the treatment was not right? So these are the things that we want to also understand, okay, so that we can prevent ourselves from getting not effective treatment, or what should be properly say is what treatment suits you the best or the most, that helps you the most or most effective functioning for you. So these are the things we want to understand. Okay, so if you are struggling with your in your mind about slimming, and you have gone through this kind of bad experience, yes, you should watch this today's live, to the end, and I welcome all the questions that you can actually type. So today's topic, okay, again, I welcome everyone, to share our Facebook link, live link to every one of your friends, who are willing to slim down, or who are facing these problems, difficulties to slim. So they are facing obesity issue. So let's be kind and help more people. Okay. So first of all, let me talk about why diet. Okay, whenever we talk about slimming, we will need to start on diet. Okay, you imagine if you always eat fast food, fried chicken, French fries, breads, cakes, ice creams, okay, a lot of cheese, steaks, okay, very nice. Wow, this kind of food, noodles, fried noodles, fried kway teow. Yeah. So what would you expect? You want to expect your body also slim, yeah, 苗条,never get weight, never gain weight. Yeah, is it possible? Possible. If you look at your children, probably where they are eating every day on all this food, but they are still not gaining weight. Okay, then you must think, why is it so? Why there are certain people do not gain weight easily if they are on this kind of bad diet, and why people gain weight easily when they on this kind of diet? The answer is very simple. It's because of different ways of metabolism in the body, which drive from the hormones. Yeah. So if you do have a good characteristic of your hormones, means your overall hormones functioning are on a higher range, higher rate, where your thyroid hormones are higher in the normal range, and also your growth hormone is higher in the normal range, and also your insulin, is functioning in the optimum way. Your DHEA hormones, your estrogen, your progesterone, all are functioning in the optimum level. Then probably you won't gain weight so easily, even though you are taking this kind of food. Yeah, but the thing is, if you continue taking this kind of food, even though your baseline characters is good, what will happen then? Eventually, you will also suppress this hormone, or you are making your body overwhelming information that eventually also will make this hormone less effective or less functioning. Eventually, you also gain weight. Okay, so these are the dilemmas of human being whenever we are living on in this stressful modern lifestyle. Yeah, a lot of people are facing a lot of stress in our life, in our career, in our work. So food is a kind of way to release stress, so that it becomes a very easy or very simple excuse for every one of us to say that a diet is part of the way for you to pacify your stress, to improve your emotion, to reduce your stress. Yeah. After food, you feel better, feel healthier, things like that. Yeah, or you feel more relaxed. Yeah, and also food is also a way for socializing. Yeah, whenever you go out to socialize with friends, with boss, with your colleagues, yeah, or relatives. And food is something that unavoidable. You must enjoy some good food, nice food that makes people happy. Yeah, when you go for travel, yeah, everyone will take some food or try the food. Why not? Okay, but the thing is, why people are so kind of like dilemma with food, because you can eat, but the thing is you must understand what is your body characters. Yeah, if your body's character is where you will gain weight easily, then you can't eat much. Or the other way is you can eat, but in the same time you should understand your body. Then at the same time, if there is a necessary to optimize the hormone, then you can do something to optimize your hormone. Then you will be able to still enjoying this kind of diet or sort of food. Okay, so this is the first knowledge or first thing that people get dilemma to. Yeah, so get this understanding right, find a solution if it is necessary for you, then you will be able to still enjoying the life or the diet. Okay, so the answers here is very simple, is because of why the reason is because of hormones. Yeah, basically if your hormones has optimum level, basically your body won't gain weight very easily. But if your hormone is not functioning in the optimum mode, then that's why you can't enjoy much on this kind of diet, like char kway teow, french fry, fast foods, ice cream, chocolates every day. Yeah, is it possible? Not possible, because your body has lower hormones level that makes your body metabolism on a lower range, and you get resistant to hormone very easily. So these are the thing. Okay, how to solve this? If you want, you can do a blood test, that actually examine your hormones. It's not a routine blood test, but you have to specifically uh, plan and also request for particular hormone test that actually look into these kind of features. Then only you'll be able to find out your problems. Yeah, okay. So I hope every one of you get some idea now. All right. Another common questions that we will always ask ourselves, yeah, we must exercise. Whenever we want to slim down, we must exercise. Exercise is difficult to do. Yeah, so a lot of people, when they are trying to slim down, they will go to gym room, go for exercise. But at the end of the day, exercise is not something that, for you to slim down just 1 day or 2 days. I would prefer to say that exercise is actually should be a kind of lifestyle, and it should not be a kind of method for weight reduction. Yes, exercise, if you do it, yeah, once a while, yeah, it may help you to reduce maybe few kilos, yeah, maybe not even few kilos, maybe 0.5 kilos or 1 kilos. Then you will immediately see result and you're happy, and then you stop the exercise. And it's not part of your lifestyle. You do it only when you're forced to do it. After you gain weight, then only you start doing it. When you lose weight, 1 or 2 kilos, then you stop doing it. So this become a kind of like method to lose weight. No, exercise is not method to lose weight. Indeed, if you are seeing people doing exercise every day, they don't lose weight, but they're maintaining their shape. So exercise is a kind of lifestyle that actually maintain your shape and also optimize your well-being, yeah, especially in the hormone side. So the way of using exercise properly is it should be cultivate into your lifestyle and become part of your lifestyle. Then when you do it exercise every day, yeah, then you will be able to optimize your well-being, especially in a hormone sense. Then if you are really enjoying lifestyle of eating those nice food, you are probably having some higher chance to be able to cope with this kind of lifestyle or unhealthy food. Okay, but this is not a way, yeah, encouraging you to do exercise for that benefits. Exercise should be cultivated for the reason to well-being. And of course, if you are already obese or overweight, what you should do is you should exercise accordingly to your comfortable level and slowly train up, okay, until you feel better. And at the same time, you start looking into diet habits modification, okay. And when you are really achieving or achieved a very good habits of exercise and your weight reduction has been optimized, and then your diet sometimes you can cheat, yeah. So these are the things is we have to see at what level you are or which situation you are. If you're already obese or overweight, yeah, it's not the time for you to keep on eating without realizing that eating will make your problems worsen and you are forgetting about exercise or you're not exercising. So start exercising with the right mindset that exercise is a kind of lifestyle. Yeah, it's a kind of well-being lifestyle. It's not for you to lose weight, but at the end of the day, exercise makes your body better, easier to lose weight, and also should be said that at the end of the day, if you keep it as a lifestyle, exercise makes your body not easily gain weight. Okay, yeah. So these are the things that we should get understanding properly, so that you will be able to get rid of your dilemmas. Yeah, because whenever a person is slimming, these are the questions that they are sort of like preoccupied and dilemmas that they are dealing with. So they probably will sort of like stop them from this kind of inspiration to lose weight. Because, for example, when we talk about a treatment for slimming or for weight reduction, probably will need some medication or supplement or certain things like that. Then a person that are so resistant to exercise or diet changes, they will probably not even wanted to start their first step to do anything. So they just hope that something that can help them to lose weight, okay, without them doing exercise, and they still can enjoying the food or diet that they're having. Okay, so the proper explanation here is if you're already overweight and obese, okay, it's not for you to enjoy now. Okay, we should delay, yeah, this sort of enjoying later. You should start improving first, yeah, by cultivating a lifestyle, exercise, and proper diet until your body weight improve or sort of like achieve, yeah, a better or slimmer condition. Then only you start, or you do have, or then only you do have the capacity to enjoy by lesser exercise or diet, more cheating all the time. But by then probably you will enjoy more by doing exercise and taking care of your diet, right? So you see, these are the dilemmas that people been talking about, been having in their mind, preoccupied in their mind, and stopping them from successful weight reduction and also successful well-being. So dilemmas, if you're turning around and around, there will be a long story, and at the end of the day, is still a lot of excuses from every one of us. So that's why I bring out in the topic discussion to tell every one of you is that these are the dilemmas, and don't let dilemmas stop your footsteps to improve your slimming. If you are willing and you realize that you do have this obesity or overweight issue, the insights in you is very important for you to start realizing what you don't have in your mind. What do you really don't understand in your mind about your body? Yeah. So today's topic is for every one of you to get a better knowledge and understanding about their body, so then they can do something in a proper manner or proper way to slim down if they need so. Okay. So all this dilemma, if you have any questions, you can always type your questions here. Let me answer for you. Okay. And the questions from Floor Sharing is asking, can use replacement meal? Okay. So sometimes when we are talking about replacement meal, we are like aiming to slim down. Okay. We take the meal for maybe 1 week, 2 weeks, or 1 month, then we aim for 5 kilos, 3 kilos of body weight reduction. Is it workable? Or maybe your friends all works well, then you want to try. And maybe the price is not very expensive, is worth to try. Yeah, and you just want to try. Okay. Again, this I would like to emphasize and again is when we want to slim down, when you do have an ambitions or objective to slim down, try to understand your body first rather than straight away step into sort of like marketing or people markets or introduce you something that ask you to try. Yeah, why you want to try? You should understand your body, what your body needs to slim down. What is it something that you already needs to do, and then only you do that. Why you want to try? You see? So Sherin, the answer is replacement meal. Yes, it's a kind of way to help into slimming, but it's not necessarily work for everyone. For proper understanding is you should understand your body. If your body need a replacement meal, yes, you should do it because you understand or you know that it may works for you. But if you think that your body, after understanding your body do not need replacement meal and it will not works for you, why you want to try? Okay, so your body is very important. You should not try. If on the other way lah, okay, if a doctor try a treatment on you, would you like to do? No, right? Yeah, impossible. Right? So we don't want to try. Yeah, if you don't have a proper understanding, probably you are thinking in the sense of, oh, it has no harm to try. But is it really no harm? Are you sure? Okay, are you sure? So these are the things that we want to let more people understand. Don't try. Do it properly. Do it in the exact way that is something is effective or necessary for you. Then you are definitely doing something for your own good and not trying. Okay. So another questions I would like to also explain a little bit on everyone who are looking into slimming is we call it insulin resistant. Yeah, what is insulin? Insulin is a kind of hormone produced from our body's organ called pancreas, and is to help our body to metabolize the glucose or sugar in our body. So if this hormone in the body do not functioning in the optimum way and it become resistant, what will happen? Common sense, yeah, your insulin would not be able to help the glucose metabolize or sort of like balance in the body. Then the glucose will start accumulating more and more in the body, and you will start collecting as fat, and you are gaining weight out of it. So insulin resistance can happen due to several reasons. Either you are always taking high sugary or high refined sugar, which is we call it glycemic index level, which is very high. Okay, so if you're taking high glycemic index, the sugars absorbed into our body in a very quick form, then you are probably having some chance to develop insulin resistance. Another condition that can make a person have insulin resistance is your genetic. If your family runs with strong family histories of diabetes, yeah, then you probably have a higher chance to develop insulin resistance if you always take sugar, yeah, or high refined sugar. So if you don't take high refined sugar and you are avoiding sugar, probably it would not trigger your genetics presentation so easily, but I still need to be aware of it. Yeah. So another important thing is stress, hormones, inflammations in the body that also can create insulin resistance. So if you are always stressful and you are always emotionally depressed, yeah, and you are always having infection, yeah, if you are always having a lot of lifestyle stress, yeah, try to look into something that can relax your mind, your emotions, or else this accumulatively inflammations, free radicals in the body can also triggers up your insulin resistant formations in the body. Okay, right? Another common factor that we found in the female is where if a ladies who have hormone imbalance character, which they may or may not present as polycystic ovarian syndrome because PCOS, they also will stand to have higher risk of insulin resistant formation in the body. Yeah. So this group of ladies is affecting about 20%, 20 to 25% of females among the even a young age group because of this. Yeah, sometimes ladies after they have stress, after they have pregnancy, after they have certain sort of like lifestyle changes, then they triggers up their insulin resistance and they start gaining weight after that. So insulin resistance is a metabolism changes in the body when we are gaining weight, right? So if a person have developed high level of insulin resistance, then it will makes the body gone into a sort of like speeded, a faster space of sort of forming or weight gain. So if a person have higher insulin resistance, the person gain weight faster and easier. Until end of the day, when the insulin resistance overshooted the threshold of your pancreas functioning, then you will turns into diabetes. All right. So insulin resistance uh, is a form just before diabetes formation, and it is a major factor into weight gain and obesity. Right. So these are the ideas or a little bit of medical information that you can get to know. Then you will be able to understand why you are gaining weight. For everyone who have insulin resistance, they always have craving. If they always have this kind of sweet food craving, they like to eat something. For example, after their meal, they want to eat some sugary sort of desserts, ice cream also can, cakes also can, something sweet. Oh, after their meal, they still have a lot of craving. They want to have something munchy to eat. Yeah, or after lunch hour, they are always have something that they needs to eat, especially some sweet food. Uh, or those people at night, they always like to have some biscuits or some snacks. After dinners. Yeah, so these are the craving that indicating that your body do have this insulin resistance. Okay, so this causes your body easily gain weight slowly until you don't realize, until one threshold it will become suddenly you gain weight faster and faster. All right. So these are the metabolism changes. Once you let this metabolism go ahead and change more and more, at the end of the day, you probably obese. When you reach obese zone, is far beyond the overweight, then you probably turning, or your body's already gone into a phase where it is more difficult to slim down already by then. All right. So say hi to San. Yeah. Yeah. Welcome to our Facebook Live again. Thanks for joining. All right. So every one of you who have problems, or struggling in your mind still about slimming, okay, watch till the end, because not only this information, dilemmas in our body, in our mind, the food, the exercise, probably you just feel not able to do it. Okay, something that you probably don't understand. So inspiring, the factor of inspiration in your body is just no fire there, so you couldn't fire up to start taking action to determine your body to slim down. And you probably having this kind of issue like insulin resistance, you are craving, but you are not realizing that these are the factor, or these are the metabolism changes in your body. Yeah. So if you start realizing, start observing the symptoms, the sign, the feeling that you have, you probably know where you are, at what situation you are, and what should you do. Yeah. This determines your sort of like inspiration as well. Okay. So another factor is also I commonly see in my patient is age factor. Okay, a patients who manage to slim down when they are during their teenager age or younger stage, is always having some difficulty to slim down when they are growing older. And most of the time they are mostly on the overweight side, okay, since young. So they are probably not overweight, or not really obese, but they are slightly overweight most of the time during their teenage age, a bit baba, a bit mitty. So but when they are gaining, when they are aging, turning into late 30s or 40 or 50, then they will probably gaining weight back, faster and faster, or easier and easier. So those people who have this kind of experience, they always will try on certain techniques to slim down, which they manage to be successful when they are using in a younger age. But the thing is, when they use it in the middle age and above, they're starting to realize that this is not functioning anymore or not working anymore. The reasons behind is because when we age, our metabolism actually drops. Yeah, why? Because our hormones level drops. Yeah, our genetics usually become our DNA become weaker, and also yeah, our metabolisms already tunes into deranged condition called, which is just now we mentioned, insulin resistant form. Yeah, when you already has higher level of insulin resistance, then your metabolism are more stuck into where you are unable to burn fat is in an effective mode. Okay, so all these factors, again, low metabolism, and low hormones, okay, and deranged metabolism pattern, high inflammation in the body, yeah, and also aging genetics or DNAs in the cells, which all these factors are the reasons why when we are stepping up or when we are getting older, then we are not able to slim down easily in the body. But it's not saying that there's the end of the day. Yeah, the proper understanding is, if you understand you are unable to slim down easier, as easy as compared to last time when we are younger, there might be something wrong. Either insulin resistant, either the metabolism problem, either the hormones issue, or either the inflammation characters. Yeah. So all this can be solved with the medical assistance, medical's way. Do it in a medical way. Maybe you need a blood test, you need an assessment with some tools. Determine out all these factors. When you get all these factors right, then you will be able to tackle all this problem in an effective way. Then again, you will be able to slim down in a successful manner again. Okay. So we are talking about so many things. Yeah. So then what are the hormones are concerned in the slimming? Yeah. What are the hormones are related? Okay. So most of the time, one of the most important hormones related is called thyroid hormones. Yeah. Thyroid hormones stays here from our thyroid glands. Everyone has this thyroid gland, and everyone's also produce thyroid hormones. So thyroid hormones functions for our metabolism drive. Yeah. So it drives our basal metabolism. So every one of us have a level of thyroid hormone. But the thing is, if your hormone is normal but in the lower range, or lower sort of like, it's in the normal range but in the lower sort of like range, in the normal range, then you probably have lower metabolism in your age. Okay, so if on top of this low metabolism due to your lower thyroid level but normal still, then you probably have insulin resistance, your body has high inflammation, high stressful level, and if you always has craving, yeah, and also looking like to crave for food, sweet stuff, then probably all these are adding on to your weight gain. Okay, and you probably will trapped in a cycle where you gain weight, okay, easier than you losing weight. So you can't help much, because hormones is own produce, you can't control it, you can't eat supplement, you can't sort of like do something to stimulate it. Yeah, but the solution is you can do a blood test to determine the level, then using a bioidentical hormones for supplementation and optimization is a way to sort of like solve the problem if you do have this low hormone level in the body. Okay, and beside thyroid hormones, what are the other hormones that related? Usually growth hormones, yeah, DHEA hormones, testosterone hormones. For female who are menopause, estrogen and progesterone also play a role, yeah, that also affecting their obesity issue. All right, so you see many ladies who are gaining weight after menopause is because they have lower estrogen and progesterone, then your body try to compensate. When the body is compensating, actually your body are trying to gain more fats, and this fat is gaining, causing you to gain weight. So, and this hormone is not really functioning, it's just compensating, and it's not in the optimum mode. So all these low but compensating hormones are actually causing the weight gain issue. What we want is actually a good optimum level of hormone, estrogen and progesterone. Then it functions to suppress the compensation, or reduce the compensation from the fats, and as well as makes your body metabolize in a better way. Then it helps your body to maintain your metabolism, reduce the insulin resistance, reduce the inflammations, and also kicks up your metabolism as a baseline. That will help you to maintain your weight, and overall you will feel well-being if you have optimum level of your hormone. Yeah, regardless whether you're menopause or not. So these are the technologies of uh, bioidentical hormones. Okay, so ladies and gentlemen, come questions. Yeah, if you have any questions, I welcome every one of you to ask. Okay, so another common question I get from my patient is diet pill. Yeah, some diet pill they actually suppress your appetite. It's a kind of like psychotropic medications. Is a control medication. When you eat it, you will get suppressed in your diet, so you feel not hungry, not craving. Yeah, but that is more for symptom. Okay, if you combine it well with your exercise and combine it well with your hormones optimization or supplements, then you probably will benefit it most. Yeah. If you don't combine it, or maybe you just take diet pill, right, and probably only certain time. Okay, for example, or your friends ask you to go out for a session, no, ladies' night, yeah, probably they will drink a lot. And after you eat this, then probably you cut down the drinking or eating. Then you do not gain weight, but you are not slimming. Okay, so these are the things that depends on how you use it. Okay, another kind of pill, kind of sort of reduce the sugar absorption from your guts after your food. So these are the medications that after you eat, okay, you can enjoy eating, cheating, whatever you eat. But then after you eat the medication, you take medication, it reduces the sugar absorption from your food in through your guts. So this again is a way to also flush out, yeah, your sugar, flush out your fats, yeah, your kind of calories from the food. Okay, it's a cheating way, but also it works, but depends on how you use it. Okay, don't try if you don't know whether it works for you, because you don't know whether your obesity or overweight issue is due to overeating or due to other issue. Okay, try to figure out, okay, what is the overall problems. If you have insulin resistance, if you have high inflammation, or if you have low hormone levels and your craving is high, yeah, and if you are having a lot of this gut issue, then probably you need to settle or tackle everyone, all the factors together. Only then it works for you, rather than just try yourself with diet pill and you may not know whether it works or not, and it may have some small side effects with this diet pill, especially the diet suppressant medication. It has a little bit of side effects in certain people, not significant side effect, but certain people will have a little bit of agitated feeling. They feel more agitated kind of feeling after taking it. Yeah, then also some of us, some of them, they may have a kind of like dependency feeling. So meaning to say, once they stop taking, they will feel like, oh, they rebound, yeah, their weight, or kind of eating a little bit more, yeah. Or some even sort of like they cause them to have difficulty to sleep after taking the diet pill. So these are the things that we need to be aware of. Don't solely depend on the medication, but if it is a medications really able to solve your problems or part of your problems in combination with other treatment or methods to slim down, then it's actually suggestible. Okay, so replacement meal. Okay, yeah, already mentioned. Yeah, and latest there are technology or medication called Saxendra. I don't know whether any one of you have ever heard about this in the market. Yeah, it's also a kind of medication, but in the injectable way. Okay, under your sort of like fats tissue, to slowly release into your body that suppress your appetite. Okay, center in your brain, and reduce your appetite. It reduce your appetite of eating. Then it helps you to reduce calorie intakes. So when you do take this kind of medications, Saxendra is a medication, so it reduce your appetite, so it reduce your intake. And if you keep on with exercise and you keep up with your sort of like uh, exercise, so you burn a little bit more, then it actually can let you lose some weight from there. Okay, so another common medication or treatment on the market is actually we call HCG. So there are many people who probably have tried HCG. How it works? HCG is actually a kind of centralized hormone. It helps to boost our metabolism by boosting all the hormones. Yeah, the thyroid, your estrogen, your progesterone, all it boosts. So when it boosts, your metabolism increases, your basal metabolism increases. So it helps to burn off more fats. And the HCG actually also have some function, preserves the muscles. So it makes your body burns more on fat rather than muscle. And at the same time, it makes you also burn faster because your muscle does not burns away. Your muscles will by itself metabolize more calories, and it actually burns more fat on that. So sometimes there are people who are able to lose weight even more than 10 kilos in 1 month by taking HCG. But the thing is, HCG only works temporarily, and most of the time people get rebounds after that because they burns off the fat, but it doesn't burns the how to say visceral fat, and at the same time it does not really reverse your insulin resistance. It does not reverse your metabolism derangement. So all this will still remains in the body, persist in the body, and then when you stop doing it, HCG will not help you. I mean, when you stop the HCG, then this condition will rebound again. So most important is we must understand what is the body really facing on. What's the body really having, the problems the body have. Then only you settle it or you tackle it accordingly in a thorough way. Then you will be able to slim down, because if you tackle it in a thorough way, you are actually achieving a healthier body and also preventing a lot of diseases like diabetes, cholesterol, hypertension, strokes, and cancers risk. So these are the important benefits that we want to aim for, rather than just only for beauty sense. Because if you slim down 3 kilos, 5 kilos, you may look slightly slimmer, but your underlying hormone problems, metabolism problems, insulin resistant problems, visceral fat issue, inflammation are not settled yet. So you should not stop by then. You should be aiming for best. Okay, so then your weight reduction will be more sustainable and not rebounding so easily. So this is why HCG may not work completely, is because it just work temporarily to improve certain sense, but it does not bring you to the ultimate goal where you need to be. All right. So these are the thing. Okay. And one important factors that people also have when they are having obesity or overweight issue is leaky gut condition. So leaky gut syndrome is a way when we have very short villi in our intestine, where it causes a lot of low probiotics and high inflammation in the body. This problem with the digestion actually causes a lot of toxic absorption in the liver, and then the inflammation creations will actually overshoot the threshold in the body. And this overshooting of inflammation also causes a lot of allergic issue, hives, eczema, psoriasis, then also a lot of cardiovascular risk on top of it. So leaky gut syndrome is also part of a reason that a lot of people are unable to slim down easily, because their body are keep on absorbing toxics, and the nutrients they are taking from the food are not absorbing properly. Yeah, importantly, because when our body are having high inflammation, our body needs more nutrition, vitamin B, vitamin C, vitamin D to help our body to metabolize and to kick out all the free radicals. But if you are having leaky gut syndrome, your body are unable to absorb all this, and it actually, on top of it, it create more inflammation. So what we need is, we need to also look into this leaky gut syndrome. Whether you have leaky gut syndrome or not, you need to see whether you have symptoms. For example, bloatiness. Gas, bloatiness is one of the common things. If you always has gas, you always pass a lot of gas, a lot of herbs, or bloated stomachs. Okay, these are the common symptom of leaky gut syndrome, and this one of the factor you have to look into it. All right, so inflammation and visceral fat is also part of a factor that people may not really look into, but it's actually a major factor when we are talking about slimming. A lot of people manage to slim down weight but not reducing visceral fat, and visceral fat is one of the main culprit for causing a person to have difficulty to slim down or sort of like rebound. It makes a person rebounds easily on their weight after they successful to reduce few kilos, but then because of visceral fat they rebounds again. So these are the issue and the reason why. So how to tackle visceral fat? The proven way is to optimize your hormone. If you don't optimize your hormone like thyroid, your estrogen, progesterone, as well as testosterone, you probably would not be able to reduce visceral fat successfully. Yeah. And insulin resistance is a culprit that causes accumulation of visceral fat. So we need to do something that can reduce insulin compensation on insulin resistance. So how to do that? Intermittent fasting is a proven way. Yeah, ketogenic diet is part of a way on top of insulin intermittent fasting. Okay, some may use metformin as a medication to sensitize the insulin, helps to reduce the workload and compensation from the pancreas. then it reduce the hyperinsulinemia, which is the insulin compensation from the pancreas that triggers on the visceral fat formation. So these are the things that we want to tackle. Yeah, looking into a persons who have obesity or overweight issue, it's not as simple as just do a treatment or whatever. So the thing is, we need to look into all these factors accordingly. Then only we can tackle successfully from all the angles. Okay. So again, just now I just already mentioned, yeah, hormone imbalance, PCOS conditions is also one of the common factors, especially females who have gaining weight issue after their pregnancy, after they have stressful lifestyle, things like that. Okay. So, all right. Before I proceed on, I would like to also mention a little bit of this uh, technology available in the market. One of it is called cool sculpting. So whether you heard about it or not, okay. So cool sculpting is actually a kind of technologies in the market that uses the cold or freeze technology, -10, about -10 to -12 degrees Celsius onto our subcutaneous fat uh, to freeze the fat cell. And this freezing technologies was proven, okay, with the evidence base to damage the fat cells, to sort of like break down the fat cell membrane, and it kills the fat cells for good. Okay, and the reduction of fat is actually about 20 to 22%, okay, in a successful mode of treatment, and the result is lasting forever. Okay, but whether you will be able to enjoy or achieve this successful rate, it depends on your body also. So a person who are good candidates for cool sculpting treatment and likely to be able to gain this 20 to 22% fat reduction are those who have BMI near to normal, visceral fat less than 6, level 6, we have a measurement here. Okay, yeah, you still can do cool sculpting if you are level less than 10, but to be able to be more successful, less than 6 is better. And your metabolism rate should be as high as possible. Then your body water should be also as good in the level that we have the measurement here. So as good as possible. And then, okay, you must do intermittent fasting if you want to burn the fat out as quick as possible. And make sure you don't have a leaky gut syndrome, or else you need to take a lot of probiotics, enzymes to cultivate your probiotics and also to start to heal your villus. And if you're having high inflammation, stressful lifestyle, hormone not good, then you also have to optimize all these hormones and take a proper supplement to improve your inflammation, or else this will reduce the efficacy percentage from the cold sculpting treatment. Cold sculpting treatment is effective, proven. No need me to say much. You can read on the technologies on the market, on the internet. Yeah, everything is there. But the important thing is whether you will be able to achieve, as promised, result as promised from the evidence base is depends on your body at that particular time as well. So our way is to make sure you are at the optimum way, optimum time to do the treatment, and then you will be able to get the result as optimum as possible. Okay. Another technology is also available currently in the market called M-Sculpt. Okay. M-Sculpt is using a kind of high intensity, very high strength of focused electrical magnetic waves. So it's not a kind of electrical wave, but it's a kind of magnetic wave. You don't feel it, but you will feel your muscle contracting because of magnetic stimulations that actually create a kind of discharge that actually moves your muscle. But you don't feel any electrical shocks, no pain, no heat, no cold temperature. But these magnetic pulses actually can focusedly stimulate your muscles to contract in the supra maximum, means over maximum movement. Means if you contract your muscles voluntarily, probably there are certain level of maximum strength that you can go. But this M-Sculpt treatment uses a kind of magnetic waves to stimulate your muscles to contract over whatever you can do in your voluntary way. So this will stimulate your muscle or awaken your muscles to contract even stronger, and makes your muscles and your nerves, your brain nerves, to start creating a new connection, and the behavior will start to increase or to become stronger. So these are the technologies available, and is one of the very good technologies here because they have FDA approved. FDA approved means they have evidence based to show the efficacy and to show the safety part. So you can less assure the technologies. And of course, our job here is to figure out your problems first. Yeah, whether you are overweight or you have body shape problems or your muscles weakness. If you already have a muscle weakness issue, then you can use MSCAP to assist your treatment as part of your plan. But the thing is, you cannot do MSCAP just to lose weight. I saw a lot of advertisement now there telling people, or you can just lie down on your bed and the MSCAP treatment can slim down your weight. This is totally wrong concepts. Okay, so I would like all the customers to understand this. MSCAP stimulates your muscle, supra maximally let your muscle become awakened, then your muscle can be trained to be stronger from what you used to be, and then it breaks your sort of like muscle behavior and become stronger. This will help you to increase your metabolism, but it's not to slim down just like that doing and you are not doing the rest. If you're having high insulin resistance, high visceral fat, high inflammation, low hormone level, yeah, so how are you going to benefit by doing just MSCAP? It's not logic, right? So the logic has to be there all the time. All right, so my sharing here today is to let you all understand what is available in the market. But the thing is, logic must be logic, so you must be able to figure out your body's problem first, then whether these technologies or this treatment are necessary or useful or effective for you. Yeah, so then we will decide from you. So if you think that you need this treatment or you like such treatment, but you are not able to benefit it at that timing, then I will recommend you to do it in the later form. Yeah. If you are not at the optimum timing or sort of like best timing to do it, yeah, you should do it at a later form. When your body is optimum to do it, then you will already benefits out of it. Don't try. Okay. My advice is always say, don't try, because if your body do not really able to benefit or sort of like function or effective out of it, then don't try. Okay, but if your body really needs it, really do have this problem that it needs MSCAP, co-sculpting, for example, then you should do it. Okay, it's not try, is you are really going to be benefits from it. So these are the things that we want to differentiate, and these are all the questions and dilemmas that we always want our beloved customers and patients to understand, so that it benefits you the most, yeah, for all your efforts into slimming and also your body shape. Okay, contouring, you want to improve your body shape, you want to improve your contouring, you want to get a nicer body figures. Yeah, these are the things that we encourage you to understand. No heights. Yeah, so clear and brilliance kind of knowledge sharing to every one of you, so that every one of you have clear mindset. Yeah, and our jobs here is to assist you, analyze for you, let you understand what is your current situation of your body and body health, and what should you do, what should you not do now, and what are the stepwise to do next and next until you achieve what you want. All right, so I'm very happy to be able to share all this information to every one of you. I hope more and more people can sort of like understand about their body needs. And I thank you for every one of you who have shared and text to our Facebook Live to all your friends and relatives. Okay. And again, I'm Dr. Jeff here from the Revival Clinic. I wish you, every one of you, stay beautiful, stay healthy, and stay slim. All right. And thanks again. And I see you again on next Wednesday. Every Wednesday, 1 to 2 p.m. is our free live Facebook live sessions to share knowledge, to let every one of you to stay and live beautifully. All right. Thank you and see you again. Bye bye.